Good morning, everyone. This is Lee Einer. I'm here to talk with you once again about Medicare for All and some of the aspects of Medicare for All that, unless you're an industry insider, you may not have considered. So the 5 greatest words I've read in recent history are covers all necessary medical care. That is the keystone of Medicare for All. And it is phenomenal for a number of reasons. Obviously, if you are not currently insured, this applies to all U.S. residents. So about 45 million of us Americans who aren't insured at all get insured. Another 80 million American residents estimated get decent coverage, full coverage, and not, jive coverage. And what I mean by that is there's a level of ACA care that the deductibles and the co-insurance combined with the premiums are so high that you have the coverage, but you can't afford to access it. So what exactly is the point of that? Except that, makes the insurance industry a whole lot richer, doesn't it? Anyway, back to the topic. This morning, we're talking about the indirect ways that Medicare for All can save you money because it is eliminating medical components that are duplicative, that are picking your pocket in a number of ways. Okay? And the best way I can illustrate that is imagine you're a unit clerk or a biller in a hospital, and they bring somebody in. He's taken a chingazo, he's taken a hit to the head, he's unconscious, and you don't know what happened. Well, the reimbursement end under Medicare for All is really straightforward because it's necessary that he get medical treatment, and Medicare for All pays for that. Under the current system, wow, it's a crazy quilt. So who pays for that person's care? How did they get injured? Did they have a slip and fall in the Walmart parking lot? If they did, then it's Walmart's liability insurance, but they may contest the liability, which throws it back on the guy's group health insurance if he has group health insurance. And the group health insurance may in turn subrogate, meaning they'll take the money back when the lawsuit is settled. But it may not be that. It might be that, he just slipped in the shower and these things happen. And that would be his medical insurance. But it might also be that he had an accident while driving. And it could be, depending on what state, is it a no-fault state or is it a not no-fault state? And is it his insurance or the other driver's insurance? And what is the cap on that insurance? Because the medical benefits under those things are typically capped. You don't know. Did he hurt himself on the job? Then it's workers' compensation and the medical component of workers' compensation that needs to pay. And this is why what should be the relatively simple task of billing if you're working in a hospital or a medical facility is not a simple task. It's a whodunit sometimes. It's a challenge, and this is part of what drives up costs in the U.S. medical system. So, knowing that you have all of these components, none of those medical components in those various insurances come for free. Somebody is paying for them. In some cases it's you, in some cases it's an employer, but somebody is paying for them. And under Medicare for All, does your auto insurance need to be selling you a medical component? No, they do not, because that falls under the heading of necessary medical care. It's covered under Medicare for All. So that medical component goes away, your car insurance premiums go down, okay? So, if you're an employer, you no longer have that component of your workers' compensation premium that you have to pay that is for the medical treatment of employees that are injured on the job. That goes away because it's covered under Medicare for all. So as an employer, your workers' comp payments go down. If you have any kind of a business that's public and you've got customers going in and out, so you have to have liability insurance, or if you're a restaurant and you have to have liability insurance also, because what if somebody eats bad pork and sues you? Okay, those things tend to go away because it's covered under Medicare for all. It's the one big tent. And this means that all of those expenses to you and your employer go away. And this means, amongst other things, that it's cheaper for an employer to hire you now. So employment tends to go up. And the money you get paid when you do get that job, more of it remains in your pocket, because even if you're a homeowner, you have to have liability insurance, and that goes down. Anyway, I wanted you to process this because nobody is talking about it, it seems, and this is a huge selling point for Medicare for all. Thank you, my friends. Have a good day. Fight the good fight and demand what every other developed nation has. Demand single-payer coverage. Thank you very much.